Hello and thanks for joining us for Healthline 3. I'm Michelle Martin. Today we're talking about the topic of kidney stones with Dr. Tommy Palmer from Regional Urology. He'll be answering your questions for the next half hour, and of course we want to encourage you to ask what's on your mind. If you're online, just click on the Healthline 3 box halfway down the right side of your screen, type in your question and submit it, or you could just give us a call. The number is 318-219-4569. We'll be taking your questions until 12:30. Now, Dr. Palmer, we've been talking a little bit already about kidney stones. How prevalent are they?
Kidney stones are very prevalent. It used to be that 1 in 10 admissions to the hospital was due to a kidney stone. It's not that high now that we do so many things as an outpatient or we treat people at home, but it's a very prevalent problem.
1 in 10?
1 in 10.
Less now?
Well, fewer hospital admissions. That doesn't mean that the prevalence is smaller. I'm not really sure exactly what the prevalence is in the general population, but they're very common.
So you're saying hospital admissions, that means that this pain is great enough to require a trip to the hospital?
It's definitely great enough in most instances to require a trip to the hospital. In fact, I have many people that come in with their wives, and she says he never goes to the doctor, and he was begging me to take him to the emergency room.
Well, that pain is great. We were talking about a person that I know that actually we called an ambulance for them, so it gets real serious.
It does.
Now, what exactly is a kidney stone?
Well, a kidney stone is a precipitation of salts in the urine that coalesce to form a stone. And in fact, if you held a kidney stone in your hand or between your fingers, it would feel hard, just like a rock.
Like a little pebble.
Like a little pebble, except not smooth typically.
They vary in size?
They do vary in size.
So can I make the assumption that the larger the kidney stone, the more pain you're going to be in?
Not necessarily. You'd be surprised. The small ones a lot of times can cause far more pain than the large ones. And some of that is because if the kidney stone is so large that it can't really get into the tube between the kidney and the bladder, it may not cause that much pain at all. That patient may actually come in with blood in their urine or an infection or some other symptom other than the pain. Or they may be having back pain that they've taken Motrin or other non-steroidal anti-inflammatories or over-the-counter pain medicine for, and then finally somebody says, let's get a CT scan and see if you have a kidney stone.
Okay, so if you were going to get a kidney stone, maybe hope for a larger one? So the pain is less? No, because I feel like there's more intervention with that, huh?
Well, the larger ones are much, much less likely to pass, and in fact, we know statistically if they're above a certain size that it's almost non-existent odds that they'll pass. So the large ones are going to require some sort of intervention. Most of the small ones, believe it or not, will pass spontaneously.
Sure. So, okay, don't hope for a size variation. Just keep yourself from getting a kidney stone in the first place.
That's right. That would be the best.
Preventative measures, guys.
Right.
Now, do kidney stones have another name?
I'm not aware of another name for kidney stones particularly.
But I have heard that there are different kinds of kidney stones.
There are definitely different kinds of kidney stones. The most common type in the United States is made out of calcium oxalate. That's about 85% of the stones. You can actually have stones that are made out of uric acid, which is a byproduct of purine metabolism. The source of purine would be animal protein or meat, higher in red meat than it is in chicken and fish, but present in all of those animal proteins. And then there are other less common stones, struvite stones, infection stones, calcium phosphate. So there are other types of stones, but the vast majority are made out of calcium oxalate.
How do you determine what kind of stone you have?
Well, you determine what kind of stone you have by having a stone analysis, or we can actually collect the stone, send the stone off to a laboratory that has the ability to analyze the stone, and we can find out what the stone is made out of. Most people assume that when we get the stone analysis back, we're going to know what caused their kidney stone and what we can do to prevent it. And unfortunately, that's not necessarily the case because there are more than one cause of having calcium oxalate stones. So we do other tests. We have the patient collect their urine for 24 hours, and we have that analyzed for certain what we call risk factors or substances in the urine that would predispose someone to have kidney stones, or a lack of those substances actually there's a substance called citrate that the higher your citrate level is in your urine, the less likely you are to have a kidney stone. So citrate's actually an inhibitor of stone formation. So we do the 24-hour urine collection, and we do certain blood tests to look for the risk factors.
Talking about citrate, is that there's some sort of supplement or something that we can take at home that could maybe we add into our regimen so we can keep ourselves from
Well, there
kidney
is,
stones?
and actually the highest concentration of citrate that you can get without having a prescription would be in lemonade. And there are many people that would recommend drinking lemonade to try to prevent the kidney stones, and that's a very good idea. The problem with that is you have to drink a lot of lemonade throughout the day to be able to get enough citrate to change the citrate level in your urine.
And you definitely want to be drinking water.
Water's great. Water's great. I tell people all the time, you know, when we were kids, you'd get half a glass of water, put salt in it, and stir it up to get it to dissolve, and then it would reach a point where it wouldn't dissolve anymore. The salt would go to the bottom of the glass. If you don't add any more salt and you fill the glass up, you can get the rest of it to dissolve. And so it's a dilutional thing with kidney stones. The greater volume urine you have, generally, the less likely you are to form a kidney stone.
Now, you were talking a little bit about predisposition and testing those stones and seeing what's in there, what their makeup is. Are you more prone, like can a familial trait have more prone or predisposition to getting a kidney stone?
They can. They seem to run in families, but you know, again, they're fairly common, and so it's not uncommon to see someone whose mother or father or brother or sister had a kidney stone as well.
So if we were looking at the whole picture, are men more likely to get kidney stones or women? How many, I guess,
Men are
in your
somewhat
profession?
more likely to get kidney stones than women are.
Why do you think that is?
I don't know that anybody's really sure about that. There are certain factors that now we know predispose somewhat to getting kidney stones. Smoking is a small risk factor probably. What's called metabolic syndrome, which is basically the spare tire around the middle, can predispose people to have kidney stones. They're more common in diabetics, so there are a lot of things that enter into it.
Now, looking at kidney stones, what are some of the, I guess, risk factors? What are threats or biggest risks associated with kidney stones?
Well, I think generally the biggest risk is just not staying well hydrated and not drinking enough fluid. We live in what we call the stone belt, and the reason why we do that is because if you look at the incidence of kidney stones across the country, it's greater in the south and in desert areas than it is in the north, and the logical explanation for that is that it's hotter down here. I've even seen one study, and I'm really not sure exactly how they came to this conclusion, but their prediction is that if we have global warming or climate change, that we're going to see an increased incidence of kidney stones because of the lack of hydration and the relative dehydration. And we're, believe it or not, all creatures of habit. We tend to drink the same amount of fluids during the winter months as we do in the summer months. And so, you know, I tell people, if you're out on the golf course and you're playing golf and you hadn't gone to the bathroom for 4 or 5 hours, or when you get in, you have to drink a couple of bottles of water before you've hydrated enough to go to the bathroom, then you're running the risk of having a kidney stone. You really have to stay on top of it. And it's difficult. You know, when I was in college, I worked the summers working road construction in Baton Rouge, and it's hard to keep up with that dehydration that you can get from the heat.
Do you think athletes have that same issue? Maybe football players, you know, doing 3 days in the summer heat?
They could, but we pay a lot more attention to hydration nowadays than we used to.
Is it fair to make the assumption that you say we drink the same amount, we're creatures of habit, we drink the same amount during winter as we do in the summer?
Right.
Do you see an uptick in the incidence of kidney stones during the summer?
We definitely do. About this time of the year, maybe into May, we start to see more kidney stones, and that lasts basically through the end of September or early October. And that's not to say that we don't see them year-round. We do. It just seems like they're more common in the hot months.
So guys, it's a cold week right now, but if you're sitting at home, you know it's about to start warming up. Now is the time to start practicing drinking more water.
That's right.
You don't want that kidney stone pain. Guys, we're sitting here, Healthline 3. We're taking all of your questions. All you have to do is call that number 219-4569. Our lines are currently open, and Dr. Palmer is a wealth of knowledge and ready to take your questions.
You know, people ask me a lot too, how do I know if I'm drinking enough water?
That
and
would
what
be my
I tell
question.
them, is if your urine looks like water, if it's clear like water, then you're drinking enough water. Typically, if you drink enough water, you're going to get up at least once at night. And I've even heard people recommend that you drink enough water to where you get up once at night, and when you get up at night, you drink another glass of water. So that's a lot of hydration, and believe me, you have to be very well motivated to be able to do that.
You have to be motivated to get out of bed.
Yeah, exactly.
Don't wait till the morning.
Exactly.
Okay, so looking at children, do they also suffer from kidney stones?
Children do suffer from kidney stones, but they're not as common in children as they are in adults.
But it's still important to make sure you're monitoring, say, like a 4 or 5-year-old's liquid intake.
Yeah, to some degree. I don't know that I'd really obsess about that because kidney stones are pretty rare in 4 or 5-year-olds.
Why do you think that is?
I'm not really sure why that is exactly.
I'm going to Google a
But
bunch of
it's
stuff
fortunate.
after this. It is fortunate,
yeah.
yeah. So whenever we're looking at people, again, who are more likely to get a kidney stone, are there any other implications or factors that put people at higher risk?
Well, there are. There's certain fluids that aren't good to hydrate with, at least, to overhydrate, I guess, or drink a lot of the fluids. And those would be things like the dark cola drinks, iced tea, coffee to some degree. Those are all high in oxalate. Oxalate tends to be the limiting factor in the formation of kidney stones. And what I mean by that is that, again, the majority of kidney stones are calcium oxalate. We have tremendous calcium stores in our bones, so the calcium is usually not the limiting factor, it's the oxalate. And the majority, or basically all of your oxalate is dietary. It's not something that's manufactured inside your body. And so spinach, when I was a resident, everybody wanted to go to Wendy's and get a spinach salad, and that's, believe it or not, a risk factor for stones. The other thing I will tell you, and I hear this over and over again, is people ask me, well, should I drink a lot of cranberry juice if I have a stone? And the answer to that is that cranberry juice is high in oxalate. So it's not really a good thing to hydrate with if you have kidney stones.
The irony is that anytime you have any other issues with your urinary tract, they're pushing cranberry supplements and cranberry juice.
Exactly.
So you could actually be causing more of a problem at the end, huh?
You could if you have a predisposition to stones.
It's important to really know your body.
Yeah, it is. Well, it's hard to keep up with all of this.
That's true. That's true. And that's why we have medical professionals like Dr. Palmer on standby. Now, if people wanted to get in touch with you, maybe they have more questions and they're not available to call right now, but they want to talk to you later, how do they do that?
Just come see me in my office. The phone number there is 318-683-0411. There are several doctors. We have 15 partners, so we're available, and we understand kidney stones are something that need to be seen immediately, usually because of the pain that people have, and we're prepared to take care of that. We really can take care of the majority of kidney stones right there in our office in our ambulatory surgery center. The way that you would typically diagnose a kidney stone is with a CT scan. We have our own scanner, so someone could come in with pain. They can see one of the doctors, they can be scanned, and if they have a kidney stone and they have not had anything to eat or drink after midnight and have someone that can drive them home, a lot of times we can treat them that day if indeed they need to be treated. And again, not everybody needs to be treated, but we can largely be a one-stop shop.
Well, that is really beneficial. Now, let's say a person comes in, they're presenting with the classic kidney stone signs. Like, where can you kind of describe that pain, or what quadrant of your body that pain would be in?
Well, typically you would expect people to have pain in their upper back or their flank, which is the area right below the rib cage.
So, like right here?
No, in the back.
In the back, in their upper back, guys.
Now, they could have pain anteriorly or in the front, but typically it would be flank pain. May or may not radiate into the groin. In men, it could radiate into their testicle, perhaps. It's localized to the side of the kidney stone, and what I mean by that is somebody comes in and tells me that their back hurts on both sides equally, then I'm not thinking kidney stone too much in that particular situation, because the pain's localized to the side that the stone is on. But the longer I do this, the more fascinated I am by how kidney stones can present. And you really have to have a high index of suspicion sometimes.
Well, you're saying you're more intrigued and interested and surprised. What's the weirdest representation or presentation that you've seen?
Maybe the weirdest that I've seen, and I've seen this a couple of times, is a young man presents to the emergency room with severe pain in his testicle. And so immediately we think of problems with the testicle and we evaluate that and we don't find anything. And as a result of not being able to find anything, he has an ultrasound or an x-ray of his abdomen, and lo and behold, he's got a kidney stone, and that's his sole presenting sign. So I see not too infrequently people come in with blood in their urine and no pain, blood that they can see, and when we evaluate them, they have a kidney stone.
Now, okay, a lot of people at home might be of the mind that I'm not in pain, it doesn't hurt, I'm not going to the doctor. But once you see blood in your urine, you should definitely make it right on over there.
Absolutely. Blood is always abnormal and always needs to be evaluated. And that's even if it goes away. But any blood in the urine definitely warrants an evaluation.
How do you guys treat kidney stones?
There are several different ways that we can treat them. Basically, we treat them either by observation for spontaneous passage. We have scopes that we can actually look up the tube that carries the urine from the kidney to the bladder. That tube's called the ureter. And so we can look up the ureter and take the kidney stone out, either grasp it and take it out intact, or we have a laser fiber that we can break the stone into smaller pieces and take the majority of the pieces out, or if we break it up into small enough pieces, we just let the pieces pass spontaneously. We can do it with a shockwave machine, or what's called lithotripsy, which is just Latin for breaking up a stone, basically. But that's a procedure where the patient would lay on an x-ray table or a table like an x-ray table. We move them around until we know that we can get the stone where we want it, and then we put them to sleep, and a little tube comes up out of the table and pushes on their side, and we deliver shock waves to the kidney stone to try to break it up into smaller fragments to where it can pass more readily.
You said something in the beginning where you grasp the kidney stone.
Right.
How do you do that?
Well, we always do that under direct vision, and what I mean by that is that we're looking at it with a scope.
Okay.
And so we have different little wire instruments that we call baskets, and you can actually advance the scope to the kidney stone, then advance the basket through the scope and kind of ensnare or entrap the kidney stone in the wire instrument or the basket and remove it that way.
Would a person be asleep for this procedure?
They would definitely be asleep for
that.
that.
Okay, I just wanted to make sure,
And
because you say grasp and I got scared.
No, they're asleep for everything that we would do for a kidney stone except for spontaneous passage, obviously.
I bet that's a lot of relief.
Lithotripsy, the scopes, we put people to sleep. We have another way that we can do the larger stones that we talked about earlier that are very unlikely to pass or maybe impossible to pass. Those stones could be treated either with the scope or with the shockwave machine, but the problem is that you may require multiple treatments, and then you have what we call the stone burden, or you have the actual fragments that you have to pass. And so what we can do there, we can actually put the patient to sleep and put a little small tube through their side and into their kidney, look in with the scope, and we have an ultrasonic drill basically that just drills the stone and sucks the fragments out at the same time. And so if you have a larger stone, that's really a great way to treat it, because it's much more likely that you can be treated once and be stone free afterwards.
I imagine that would be preferable.
It is in certain circumstances.
Now let's say I've made it to the hospital, I definitely have a kidney stone, but you've assessed that it's one that I can pass on my own. What do I do now?
Well, what we would do then would be send you home on pain medicine if you need it. I would typically send people home on, again, that alpha blocker or the drug for the enlargement of the prostate gland, what's called Flomax. The reason for that is that there's studies that suggest that that increases the chance that you can pass the stone spontaneously. I think the jury's out on that. I tell people for every study that shows that you can more readily pass a kidney stone on Flomax, there's studies that say it doesn't make any difference. And so I basically prescribe it to everybody and tell them if you can tolerate it without side effects, then take it. If you have side effects, throw it away.
What are the side effects of Flomax?
Dizziness would be the main one. The other thing, I mean, this is just an aside, but Early on, before word got out, I would always tell the women, I'm prescribing a medicine for you that is used to treat enlargement of the prostate gland, and I know that, because they would go to the drugstore and the pharmacist would say, well, this drug's to treat enlargement of the prostate gland. And they'd call me back and want to know
Sir.
what was going on. They thought I'd lost my mind.
I would just be like, my doctor said give that to me.
Yeah, yeah.
Now, okay, you were talking about, the disputes between whether or not Flomax is effective or not. What
Right.
does Flomax do? Does it make any openings larger?
Well,
or?
we think it relaxes the spasm or the tension in the muscle of the ureter. The ureter is kind of like the intestines, and it's not like pouring fluid down a garden hose. It actually milks the urine from the kidney down to the bladder. And one of the ways that you can get pain from a kidney stone, that sudden increase of pressure that we talked about earlier, is spasm. The kidney stone gets into the ureter, it irritates the lining of the ureter goes into spasm, you get swelling, and then you get the obstruction or the blockage as a result of that. And so that's why even the small ones can cause a tremendous amount of pain. And when you actually pass the stone or the stone's removed and you look at it, and your natural inclination would be to look at that and think, you got to be kidding me, this caused all that
It's
pain.
tiny.
But yeah, but it causes a tremendous amount of pain sometimes.
I've heard women that have had babies describe it as more painful than childbirth, natural childbirth.
Well, childbirth period, more painful than labor pains. I've been doing this for a little over 32 years, and only once in my career have I had a woman tell me that she thought that labor pains were worse than a kidney stone.
All right. I'm
So-
just going to try not to. I've had the labor pains.
So if you
and
get to
they were
choose
awful.
between the two, the labor pains are better.
You're saying
And
that's the
you,
lesser of two evils, and you get a baby.
Well, that's right, and you get a baby at the end. So-
Well, if you have to
and
choose.
who wants a kidney stone?
I mean, you could keep it in a jar.
Well, you could.
Name it Steve.
That's right. I've had people ask for it, want to take it home.
It would be
I
a
tell them
daily
they're,
reminder.
To some degree, more valuable than diamonds, at least as far as the expense.
You worked hard for that.
That's right.
And it would be a daily reminder to drink your water.
It could be.
Now, what are some of the complications with kidney stones? Like we kind of talked about the impact, but are kidney stones dangerous?
Kidney stones can be dangerous. When I started, we would see people that had to have their kidney removed as a result of complications from kidney stones. We almost never see that anymore. That would be a very uncommon problem. But what we really worry about is the combination of a kidney stone and infection. Because if you have infection and you have an obstruction and you have the increased pressure in the kidney, then that can kind of push the urine back into the bloodstream, if that makes sense. And then you have infection in your bloodstream. The real problem there too, in addition to that, is that until you get a tube in there to drain that infected urine out, it's going to be much more difficult to get rid of that infection, even with antibiotics and that sort of thing. So occasionally someone actually will die as a result of a kidney stone or an infection.
So guys, it is really serious. I mean, we're making a couple jokes about keeping that stone in a jar, but this is something that can impact your well-being, your life. So I'm understanding that if you have a kidney stone, it's hard to pass urine because it's so painful.
Well, if you have two normal kidneys, you're really not going to see a decrease in your urine output.
So
you can totally obstruct one and still have an adequate urine output.
Okay, so the pain doesn't happen whenever you're trying to urinate. It happens just sporadically.
It's typically an intermittent pain. It's a very severe pain that may come and go, and come and go kind of in waves. People will say, well, I had this terrible pain, and then it kind of let up for a little while, and then it came back, and I had the terrible pain again. And the other classic finding is when people present to the emergency room in that pain, they typically can't stay still. If they're on a stretcher, they're rolling around on the stretcher. If they're not on a stretcher, they may be pacing out in the waiting room. And it's almost like you can look out into the waiting room and say, that looks like a kidney stone right there, probably. I'll bet that patient's got a kidney stone.
And it's all about those spasms around that stone.
It is, and the pain. They try to find a comfortable position, and they can't get in one.
Now, okay, so we talked about the implications. We talked about people who are more likely to suffer from kidney stones. One question that I had with regard to that is, are there any medications that you could take or that you're taking that might make you more likely to have a kidney stone?
There are some medications out there that'll make you more likely to have kidney stones. They're kind of few and far between, fortunately. There are medications that we can frequently treat kidney stones with, and what I mean by that is the majority of kidney stones we can't dissolve, unfortunately. There might be a Nobel Prize waiting for somebody if they can figure that out. But we can, in many instances, prevent the formation of new stones. And we can do that sometimes by altering the diet, sometimes by increasing the fluids, sometimes by putting the patient on certain medications, or a combination of all three.
So do you try altering the diet first?
It depends. It depends on what their risk factor is. If I can convince someone that they should have a 24-hour urine collection and the blood work, and I can identify a risk factor, then I treat that particular risk factor. And you know, if it is something that could be treated with hydration or with diet, then I'll suggest that to the patient.
Are there any foods that a person prone to kidney stones, given whatever predisposition they have, should avoid? I mean, I know you talked about spinach. Is there anything else that falls underneath that?
Well, salt is the main one. Salt increases the calcium in the urine. And so, you know, I tell people that have had kidney stones, drink a lot of fluids. Water's preferable. Lemonade is good. Some of the lemon lime flavored diet sodas are good to hydrate with if you want something like that. And try to eat a low salt diet. And you know, I got to admit, I don't really pay a whole lot of attention to what I'm eating necessarily, but I was in the grocery store about 6 months ago, and I was looking at cereal, trying to decide which cereal I wanted, and for some reason I was looking at the ingredients, or the little, you know, how many carbs, protein, that sort of thing, and I was shocked to see that they had salt in the cereal. And if you look at the ingredients of our foods in the grocery store, the majority of them have salt. We eat a lot of salt in this country, and that's a risk factor.
And so it's not only important to know your body, know what you're putting into it, what's coming out of it, but also what you're putting into it. Like, if it is hidden, it's all hidden. And so you really do have to keep a very keen eye on what you're putting on your plate.
Yeah.
So we talked about passing the kidney stone. Like, if I'm going home, I'm going to pass this on my own.
Right.
You send me home with pain pills and a prayer. What specific pain medication do you give people?
Well, I typically give people a narcotic pain medicine, an opiate, and I know there's some controversies and some new laws around that. But I also tell them, if you get the severe pain, unfortunately, there's nothing orally that's going to take care of that. You're just going to have to go to the emergency room. The other thing that I tell them is that a little bit of pain is easier to get rid of than a lot of pain. And so if you think, well, maybe this pain's going to go away, and you sit around and let the pain come on like gangbusters, you're behind the equation then.
And that's why you always see a lot of people coming in pacing and writhing in pain, because I mean, I think our natural, you know, predisposition is to say, okay, well, it hurts a little bit, I'm gonna wait this out.
Right.
I don't want to go to the emergency room, that's expensive.
Right.
So are the I guess the treatments for kidney stones, are they typically covered by health insurance?
They are typically covered by health insurance.
Now, if anybody had questions about whether or not their particular brand of insurance covered the treatment for kidney stones, what do they need to do? What should they?
Well, if a patient comes to see me with a kidney stone and we have decided that they need surgery, and by we I mean the patient and me, then we contact their insurance company to pre-cert it, and we also find out how much out-of-pocket expense they can expect around that, depending on what their deductible copays or that sort of thing.
Because that would kind of involve like a CT, and that gets really expensive, and everything that goes around that.
Right, but we pre-cert all of that.
Awesome.
Yeah.
So again, some takeaways from kidney stones and the information people should take with them. Maybe drink lots of water.
Drink lots of water, stay well hydrated, especially in the summer, especially if you're doing yard work or playing tennis or whatever outdoors. And try to eat a low salt diet. And to me, a low salt diet just means don't use the salt shaker.
It's that easy, guys. Just put it down.
Yeah.
And also treatments, either you're going to pass it on your own or you can have medical intervention.
That's right, and we have very effective treatment for these kidney stones.
Again, if people want to learn more information or ask you questions that they didn't get to answer here, I don't know how because we went through everything. What do they need to do? How do they call you at your office? Just
call me at my office. It's 318-683-0411.
And is there like a website that they can go to get more information?
We do. We have regionalurology.com, and we have a lot of information on that website as well. Not only about kidney stones, but about a lot of other things as well.
And again, guys, if you have that extreme pain, don't wait. And if there's blood in your urine, don't wait, because this can escalate from severe pain to maybe even death.
Exactly.
All right, Dr. Palmer, thank you so much. I feel extremely well informed about kidney stones. So if you see me out in the streets, ask me some questions. All right, thanks, Dr. Palmer.
Thank you.